New calculator predicts when it's your turn for the COVID vaccine. If you're wondering when your time may be to get the COVID vaccine, a new online tool may be able to help. The calculator will be able to give you an estimate of when you could expect to receive your coronavirus vaccine. There are several questions asked to work out where you are in terms of priority to receive the jab. These questions include your age, whether you live or work in a care home, and if you are a frontline worker. The Omni calculator will then be able to guess your likely place in the queue based on your answers. The tool only offers a predicted estimate and is not an actual calculation. The Omni calculator site says, you will then see an estimate of the maximum number of people who are in line to receive the vaccine before you. We also indicate how long it might be before you get the vaccine, based on the vaccination rate. By default, we base these figures on a vaccination rate of 1 million vaccinations a week and a default take-up rate of 70.6%. The Pfizer jab will cover only 20 million people, as the government secured 40 million doses. Nearly 140,000 people were given coronavirus vaccine jabs in the first 7 days after the rollout began, it was confirmed yesterday. Since 90-year-old Margaret Keenan became the first person to receive the approved Pfizer COVID-19 vaccine last Tuesday, 108,000 people have been given the jab in England. A further 7,897 have been vaccinated in Wales, 4,000 in Northern Ireland and 18,000 in Scotland. The figures were revealed on Tuesday by Government Minister Nadhim Zahawi, who is overseeing the biggest mass inoculation program in British history. But England's Chief Medical Officer Chris Whitty warned social distancing will need to continue for months to come, as vaccinating the most vulnerable won't be enough on its own to fight COVID. The government is currently working through a priority list of 20 million most vulnerable, including all over 50s and all adults who shielded in March. There is no current firm plan for how or when people who aren't in the priority groups might get vaccinated.